Okay, everyone, welcome to the Provider Collaborative webinar about referrals to aging and people with disabilities. Our agenda is on your screen. We'll go through introductions quickly, talk about acronyms. We'll discuss the application questions that trigger an APD task. We'll talk about the task review process, the referral process to APD, the various member notices that applicants who have had their case referred to APD may see, best practices, and other resources. So I'll let Maria in the room introduce herself.
Hi, my name is Maria Gonzalez Duran. I am the eligibility manager for APD with OHA.
And I'm Colette Bird. I'm the provider campaign coordinator with Oregon Health Authority's Community Partner Outreach Program. I work specifically with our community partners who are part of OHP provider organizations. So some common acronyms we want to run through before we jump into this presentation. OHA stands for Oregon Health Authority. DHS, Department of Human Services. OHP is Oregon Health Plan. APD is the Department of Human Services Aging and People with Disabilities Division. APD medical programs available through DHS APD, and this includes the Medicare Savings Programs as well as Oregon Supplemental Income Program Medical, or OSIP-M. MAGI stands for Modified Adjusted Gross Income. MAGI Medicaid programs are those Medicaid programs available through OHA, otherwise known as Oregon Health Plan. One is Oregon Eligibility. This is our eligibility determination system for our MAGI Medicaid program. And one little asterisk that I want to point out is that while Oregon Health Plan is OHA's MAGI Medicaid program, APD may also use that term OHP, so sometimes folks hear that term through the medical programs available through APD as well, but generally speaking, Oregon Health Plan is the MAGI Medicaid programs available through OHA. Okay, so let's talk about the questions in the OHP application and in one that trigger a task for a staff member to review the case to determine if the case needs to be referred to APD. So in the application, if it's indicated that someone is 65 or older, that will trigger a task. If someone is receiving Social Security disability income, that will as well. If someone's receiving supplemental security income, if someone's enrolled in Medicare, has a disability that will last more than 12 months, and or needs assistance with daily activities such as walking, eating, or remembering, that will trigger a task. And then in addition, if they've indicated that they're legally blind, that will also trigger a task. So these are the different questions that will trigger a task in one, in which case a staff member will then know that they need to go and review that case for an APD referral. So I'll let Maria discuss the task review process.
So staff member from Member Services, an APD team member identifies the task in one. That's through the worker portal. Once the worker reviews the task, based on the indicators, he or she will decide if this is a possible referral to an APD branch. So the worker reviews the case, sees if the individual is eligible for OHP. It's necessary to point out that not all tasks are going to end up in a referral. Sometimes the client, even though, for example, might be blind or disabled, they would still be eligible for our programs. The question that would trigger a referral is when the client is requesting services. Then that would be an automatic referral to the APD branch. So once the That's determined by the worker. We mark the task as complete. We send the referral if that was the necessary action.
And it's important to note that the task processing time can vary. So a task, may be worked in a day or it may take a week. It just depends on the volume and any projects that this team is working on at any given time.
So if the staff member deems it for appropriate to refer a case to APD, they emailed APD branch office closest to the individual, determined by individual's physical address, with the task number in 1. So pretty much what happens is we locate in our HZIP locator, we locate the individual's address, and that's the way we decide what APD branch this client is going to be referred to. Then the task is typically reviewed by an APD branch office staff within the 45 days of the emailed referrals. The APD contacts the member to complete eligibility determination process for APD medical programs. So the member would most likely receive a notice from this branch saying something similar to, we received a referral from OHP, and they do have their own application process, so the client might be receiving an application along with the notice.
So some common scenarios that we want to run through. The first is, let's say a new applicant who doesn't have current benefits is found ineligible for OHP through 1, but their application has triggered an APD task. As we mentioned, the staff member will review the case, and in this scenario, let's say they do deem it appropriate to refer the case over to APD. The applicant will then experience the following. A notice, Form 645H, is sent, which says they are denied for OHP and says they should contact APD. A number is provided for them to call to find out which branch their case was referred to, but it is important to know that the applicant is not informed through the notice that a referral was made. So they should call that number to find out which branch their case was referred to. An APD case staff member from their local branch will follow up with the applicant, typically within 45 days of the referral. Another scenario, let's say the member is turning 65 and is currently receiving OHP benefits. An APD task is generated in anticipation of the birthday, reviewed, and a referral is made to APD. That APD branch office will then contact the member, but let's say the member does not respond. APD will notify OHP, and at that point the client will experience the following. A notice, either Form 645A or C, which says that they no longer qualify for OHP and that their existing benefits are closing. The reason given is that they are entitled to or enrolled in Medicare. They are not informed that they are also closing because they did not respond to APD. The last scenario that's the common one that we'll talk about, let's say the member is currently receiving OHP and their case is referred to APD. Once the member is contacted, let's say they follow all the necessary steps. They are found no longer eligible for OHP and are enrolled into a Medicare savings program. They will experience the following. A notice is sent to them which says their OHP will be reduced to a Medicare savings program. It'll say which specific program it will be. It will also inform the member that an APD branch office caseworker will contact them. The notice does not tell the member to contact APD or which branch the case was referred to. In this scenario, they can also always call OHP customer support to find out which branch their case was referred to. So to review some of those notices, the combined notice of eligibility is the 645H. The denial or closure is the 645A or C. And then the reduction of benefits is the 648B. So what happens in any of these scenarios if the application is urgent? If a member has an urgent application and may be eligible for APD benefits, they should contact their APD office as soon as the application has been referred. They can find out again which branch office their case was referred to by calling OHP customer support. Community partners can also help with the steps, and they can also contact their CP team through OHP customer support to find out on behalf of the client which branch their application was referred to. If for some reason once they contact the branch and they have any issues, they can always ask to speak to a branch lead, especially if there's an urgent situation and the member needs help quickly. So some best practices. We know that APD branch policies may vary, so get to know your local branch office. Some of them may require that the individual apply for OHP first before applying for the APD medical benefits directly. So now that you're familiar with the referral process, you know how that works. So even if they're not eligible for OHP and we don't think they're going to be eligible, they may still require that they apply through for OHP first. And we know some may allow the applicants to apply directly with APD, but it just varies. Some may require that OHP denial and referral first. Again, if you're unsure if the case has been referred to APD, contact OHP customer support, and then assisters again can contact the CP line. And we have actually a new number available for community partners only, so only folks who have an assister ID. And they can contact this team directly to find out which branch office an APD referral was made to. So some resources. We mentioned OHP customer support. There's also a hyperlink to the APD branch office locations. You can also do a quick Google search of DHS APD branch office locations in Oregon. We have the Medicare Savings Programs brochure, which is DHS Form 9017. More information about Oregon Supplemental Income Program Medical, or OSIP-M, is DHS Form 9831. And then also there's the Aging and Disability Resource Connection line that is available for anyone who is seeking information about a variety of resources for aging and people with disabilities. If you have additional questions or concerns, you can always email me, and I can work with our subject matter experts internally to get questions addressed. And again, this is Colette Bird, and I'm with the Community Partner Outreach Program. So thank you so much for your time. Please reach out with any questions. Thank you so much to Maria.
Thank you.
And we'll see you all soon. Thanks. Bye-bye.